Since last November, doctors have been treating large numbers of children for measles here in Likasi Hospital in the Katanga province in southeastern Democratic Republic of Congo. 3,800 patients have been treated for measles in this hospital alone. Children who do not receive treatment die in 5 to 20% of cases. Fever and skin rash are the first symptoms, but complications can occur.
The average length of stay is just over 3 days. There's a lot of cases with complications of pneumonia, complications of dehydration.
Médecins Sans Frontières is working together with Ministry of Health teams. When the epidemic became apparent, a vaccination campaign was planned for the end of January to reduce further spread of the disease.
The Ministry of Health has been actively involved in the planning, in the surveillance, and in the provision of the people who are carrying out the campaign, the teams. Presently, we have 30 teams in Likasi. Each team consists of between 10 and 15 people, depending on the size of the site.
Every morning, teams consisting of a logistician and a nurse set off to help the Congolese teams at the numerous vaccination sites in Likasi. They'll then move on to Kasanga and Lubumbashi. To fend off the epidemic, they need to act fast. Médecins Sans Frontières and the Ministry of Health have given themselves less than a month to vaccinate 1.2 million children in the region.
C'est très bien fait comme ça.
Grozny, capital of Chechnya. MSF opened an office here in 2007. The Republic of the Russian Federation, strongly marked by 2 wars with Moscow, was for a long time judged too unsafe for Médecins Sans Frontières to intervene.
In the year 2000, after the Second War in Chechnya, MSF set up a project in Ingushetia with a team providing assistance to displaced Chechens. For security reasons, MSF was unable to work in Grozny. This became possible in 2007. The team consists of national staff only, 37 of us. There are no expatriate staff, again for security reasons.
Tension continues to run high in Chechnya, and for this reason the project is coordinated from Moscow.
The coordination team comes to Grozny from time to time. Once every 2 months or sometimes twice a month. It depends on the situation and on any administrative problems. But trips are much easier now.
Les mouvements, les voyages sont assez faciles aujourd'hui.
A few months ago, Médecins Sans Frontières started giving medical consultations in a couple of towns in the north of Chechnya. Although relatively unscathed, this region has benefited little from the reconstruction projects. Like in Grozny, MSF provides gynecology and pediatric care in this health clinic in Kalitnovskaya. Large numbers of women come to the clinic, sometimes with children born during the war, like this young boy.
I gave birth at home. There were roadblocks, they wouldn't let me through. It was during the war. I knew I wasn't feeling right. An aunt told me what to do if the birth went normally. I think I lost consciousness. I only really came around afterwards. Nobody could come and help me.
Many Chechen doctors have either left or have resorted to other means to make a living. As for the population, often they can't afford to consult the doctors who have remained. Despite things returning to normal, the health system is still struggling. At the end of the 1990s, Médecins Sans Frontières set up a project at the hospital in Chiratsulu, a town in the south of Malawi, a country particularly hard hit by the HIV/AIDS pandemic. But doctors felt helpless. Although they were able to work on prevention, the treatment of opportunistic diseases like tuberculosis, and palliative care, they had nothing to fight the virus itself.
Pourquoi vouloir introduire les ARV? Parce que
Why introduce ARVs? Because our doctors are dealing with opportunistic diseases. Our patients come back time and time again and we end up burying all of them. As a medical organization, it's our duty to treat people.
The situation finally changed in August 2001 when MSF set up its first antiretroviral or ARV programs. If they proved conclusive, they'd be introduced elsewhere. Back then, MSF was treating just 500 people with these drugs.
Okay, for today we have to choose three. Three only.
Finished.
Yes, finished.
The implication is that these medicines, once you start them, you need to take them for life. Okay? At least at this point in time. Perhaps 10 years from now, someone will invent a cure for HIV. But for the moment, there is no cure. The decision is, at this point, it's up to you. If you want to take the medicines, then...
I'm ready.
Okay.
I'm ready.
3 in the morning and 3...
Very quickly, the teams wanted to scale up the number of patients on ARVs. In order to do so, the treatment protocol needed to be simplified, a process which called for the training of local staff. Due to the lack of healthcare workers, nurses received special training in order to start patients on ARVs and to ensure follow-up care for stable patients. MSF also wanted to make treatment available closer to people's homes. In collaboration with the Ministry of Health, MSF started decentralising care from hospitals to health centres, a process that was completed in 2009.
Now
we're in a new phase. As care is now accessible in most parts of the district, we're thinking more about the long term, and obviously this includes the possibility of handing over MSF activities in the district.
The number of patients receiving ARVs has increased from 500 in 2001 to 18,000 in 2011. These past 10 years have shown that a large-scale antiretroviral program is possible in precarious situations.
My name is Rola Sharqiye. I worked with MSF as health promoter in Burj al-Barajni camp. As health promoter, my main responsibility is to raise awareness concerning mental health. And by raising awareness, I will try to diminish the misconceptions about such kind of service and the stigma that is related for persons seeking for mental health intervention.
This maze of narrow streets is in the Burj al-Barajni camp on the outskirts of Beirut, the capital of Lebanon. 18,000 people live here, cramped into 1 square kilometre. Most of the Palestinian refugee families living here arrived more than 60 years ago. Decades later, they still haven't left the camp.
What do you find the most difficult?
For me, it's health. Concerning my financial situation, if necessary, I can survive on bread and olives.
MSF set up a mental health programme in Burj al-Barajni camp in December 2008. In 2 years, the teams have treated more than 1,000 patients. The overcrowding, poverty, unemployment and successive wars have taken a toll on the population's mental health. In such situations, depression and anxiety are common.
In the camps, there are a lot of people with signs of mental suffering, and some of them presenting with psychiatric disorders. There are some people who have real problems coping with daily life. They have problems working, problems on a daily basis at home. These patients are our priority. It's them we want to treat first.
If my hand hurts or if I have a pain in my chest, I go to the doctor. But if I'm suffering mentally, I don't know how to take care of myself.
Amira is aware of her illness, but when she first decided to seek help from MSF, she did not tell her entourage. It is hard to break the taboos surrounding mental illness, despite the fact that here in the camp, 1 person in 3 is in need of psychological care.